First of all, TGIF. You guys already know our favorite part of the week. This is our way of, talking about wellness and trying not to make it so boring. Pretty much, long story short. For anyone that's been here before, you already know how it works. For any new people, we're going to go ahead and just, discuss some wellness topics. Christina will get more into the topic at hand and our special guest. For those of you that have any questions or anything you want to share, hit us up in the chat. I'll be monitoring the chat. If anyone has any questions, I'll bring it up to our speakers or Ms. Christina so that way we could address that. If there's any information we want to share or links, feel free. I mean, we're trying to keep it interactive, so we've had pretty good participation in the past, chat-wise. So don't be shy. Miss Christina will share some information afterwards in an email, send a survey link and all that good stuff. We really want to make you feel comfortable enough to ask any questions, anything you need clarification on. Like I said earlier, we have the pros on here with us today. So, we've had him, Mr. Daniel before. So, he knows how it works and he's real easy to talk to. So don't be scared because he's all super swole. But with that being said, Miss Christina, you want to take it away?
Hey guys, so a little bit before we start, I just want to get you guys some information on some upcoming shows. So next week, we're launching full force with Heart Health Month, and we're going to have American Heart Association on, and they're going to talk about understanding heart health and give us some resources. If you guys have ever been on their site, there is a wealth of information. It's like so much. I mean, from nutrition to physical activity to stress management to even inflammation. So that'll be a great presentation on that. On February 19th, we're going to have the Department of Health on with Tony. I don't know if he's on today, Tony. He's going to be giving a Be Well information session. So we've talked a little bit about what the Be Well program is, and if you have any interest in it whatsoever, that is the day to join so that you can have like a rundown, understand what it's going to consist of, and how supportive you're going to be in this program. There are some pre-registration requirements, so I will send that information out to you today, and it'll also be broadcasted. So be on the lookout if you miss the email after today. And on February 26th, February is all about love, guys. We talk about giving love to other people, but who's more important? Giving yourself some love. So we'll be focusing on self-care and why that's important. And just some other upcoming news. I don't know if you guys have registered for the Live Active Wednesday Wellness Bites or Healthy Bites. So those are some great information on nutrition. Take advantage of those. All of this is free. And then just keep it on your radar. In April, there's the Walk the Walk Teen Challenge. So start recruiting those team members and participate. I think it's groups of 10, right, Roman? We've done this before. It really helps because you can just motivate each other. If you normally don't walk a lot.
It gets competitive.
Oh, for sure.
It gets serious for sure.
Yeah, so all that's coming up. And now, without further ado, let's get into our topic at hand, and that's inflammation. Inflammation is such a buzzword. Like, you hear it everywhere, causing all sorts of chaos. I'm going to leave the actual description of what it is to the experts. And we have Dr. Jimenez, who is a functional medicine practitioner. And I'm going to let him explain what that is as well, because if y'all have never been to one, the information that you can get from them is absolutely amazing. And then, of course, we have our friend, our supporter, Daniel. Thank you so much for being here. Owner and lead trainer from Push Fitness. So thank you guys for joining. I'm gonna let you guys take it away, give some introductions, and then get into the topic. And we'll just ask questions as we go.
Okay. In terms of beginning the process, first of all, I have to thank you guys for allowing us on here. One of the things that we love doing is being part of a learning process for El Paso. As part of a community-based group, we enjoy talking about subject matters that affect our population. Daniel and myself have been individuals that have worked on and have worked together probably well over, I'd say, about a good 15 years or so, probably longer than that. We focused on taking care of individuals from the beginning of maybe their issues physiologically, but we also deal with them on the emotional side of it. As an outsourcing of things, functional medicine is the combination and understanding of how to deal with chronic disorders. At its basis, inflammation becomes one of the most important subject matters at the root of all causes. So by the time you start practicing medicine, whether you're a cardiologist, whether you're a orthopedist, you deal with inflammation at your own area, such as in your joints, such as in the area of the lumen arteries. Danny and us, we deal with patients on the physiological side of things, on the biomechanical side of things, but we by no means don't interact with inflammation at its basis. So we've learned a lot about inflammation, and what we understand today, it's probably one of the most central themes affecting immunology, cardiology, neurology, every sort of ology you can find gets its basis through inflammation, to the point where there's actually a new outbranching of doctors called inflammologist, where basically we can determine how things interact with themselves. Now, when we look at certain areas, Danny and I, we work on each individual patient individually, and we focus on a functional medicine approach. A functional medicine approach is to look at things more from long-standing disorders and issues. So one of the important components is to understand the particular problems an individual has and work up a case individually. So as we do that, we realize that inflammation, whether it be at the arterial area or even in the brain or even at the gut, we have to understand that it does have its beginnings. So there's much to talk about. So I'm open for questions, and I can kind of take it in any direction you wish.
I think that's a great foundation of understanding what inflammation is. I mean, especially, just as a beginner, like understanding the components, it can be pretty much in everything. I hear it revolving a lot around like gut health, but how specifically does it affect the heart?
Well, one of the things is that in, let's say, prior to, I'd say, the 2000s, we would always look at the lumen or the arteries or the arterioles at the smallest level. We really understood that at its basic, it would be clogged and there would be cholesterol plaques. And we learned that our goal was to prevent cholesterol. Cholesterol got a bad rap in the 70s, 80s, and 90s, beginning from the story of the egg on Time magazine, that cholesterol was a bad thing. Today, we've learned that cholesterol is a good thing. However, we have to mediate and manage the lipid profiles of individuals. So today, what we look at, and we understand that many interactions affect the artery at the molecular level and at the lining level. So we try to figure out what is it that affects the artery before the clotting or the issues of myocardial infarction occur. What we learned is that we can go back into and to find problems back into the diet. So what we've learned also is that it's not so much of a fat issue, it's an inflammation issue. Typically, what we've learned is that a lot of times you would say back in the day, fats are bad. However, today we learned that fats are good fats. So we understand that carbohydrates are at the root of much inflammation. So what we have to do is we have to understand that there are things that cause arterial issues, such as inflammatory states, oxidative states, lipid profile states, the level of the blood markers that we evaluate, such as triglycerides, lipids, HDLs, LDLs, high blood pressure. Those all factor into. But one of the things that we have to do is we have to consider, as you had mentioned early, mind things like emotional things, relaxing things, transcendental meditation. That's one of the things that we want to bring into the fact that we can help people and decrease stress and decrease the effects on arterioles by many things that we can do from our diet. Now, you mentioned something about gut. Gut has a lot to do with what we eat and also our microflora. So today we understand that if we deal with the issue of understanding the biome or the microbiome in our bodies, well, we can also understand the issues that are affecting inflammatory states and create an inflammatory oxidative load on the body. So we understand from complex ways that the gut directly implicates the coronary arteries. The diet affects the coronary arteries. The stress level affects the coronary arteries. So we look at a bunch of different components, and we come up with the realization that we've learned a lot. Today, we can actually see inflammatory states even at the genomic level. So one of the new advents of medicine is that we can really see into human genomes and understand if a person has certain gene predispositions and adapt to their diet and make their diet recommendations based on the genetic profile. Now, we don't want to make a dogmatic opinion or a point saying that you have this gene, so you're going to have heart issues. It's just susceptibility. So those are the areas that we look at now from a functional medicine point of view, not only genetics. We look at environmental life choices. We look at their particular vascular dysfunction. We assess it. We look at their anthropometric measurements, which are body fat composition ideals. And we can make some decisions based on what's going on. Working with the cardiologist helps us also build the better treatment plans or care plans for patients in the treatment protocol, if that makes sense.
Absolutely. So I think like inflammation, a good way to kind of explain it is a lot like stress. Like your body reacts to inflammation for certain things, and it's really good. Let's say like a bee sting. And when there's too much inflammation throughout your body, like that's when it's really bad. Just like stress. Stress is good for your body to do certain things. You know, you're being chased by an animal. But when stress is continuous, then that's when we have problems, right?
Yeah, right. So like, if you notice, like in primitive times, most people, all they had to worry about is being eaten by a tiger and, you know, getting attacked by another tribe. But once that happened, they would let it go just the same way an animal, you know, if there's a predator around, they get stressed for a minute, but then they go back to their homeostatic state. So they go back to balance. With us, when it comes, for example, like April 15th tax day, there's only so much you can do rationally and logically to reduce that stress, but it's not going to go away. So you have to find a way to let go of that so you're not constantly in an unbalanced state. And the more we're not in an unbalanced state and away from homeostasis, then the more stressed we are. And if we don't figure out how to revert that, all of those free radicals will form in our body, causing more inflammation, causing more stress, causing us to, you know, feel older, look older, and at the same not have a clear mental understanding of how to approach life on a daily basis. Because you're always, even before you wake up, you're just like, I got to deal with this, I got to deal with that. Whereas opposed to if you find a way, like how Dr. Jimenez was saying, to find a meditative state on planning, hey, I'm going to wake up in the first 10 minutes. I'm not going to look at Instagram, social media, or anything like that. Instead, I'm going to put on something positively optimistic to enrich my mind and to regenerate that. Because at the foremost, people will like, oh, I got to get on this diet and I get it. And then before you know it, they're stressed about being stressed. So then they're just adding more stress.
Yes.
So then it's a never-ending cycle. So finding a small balance, like very, 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 it's just a small different state of mind that you can do in the mornings or midday that allows you to reset your body will start helping with that inflammation. And of course, Dr. Jimenez said, going back into your gut flora, ensuring that you're processing, digesting correctly. And a lot of times, it's not that diets don't work. It's if you look at your digestive system, it's like you have clogged pipes. You know, you got to call a plumber if your pipes are really bad, right? To, you know, get everything going again. Same concept with the digestive system is you have to find prebiotics, probiotics, things like that will help re-regulate your digestive system so you can start metabolizing everything more readily and absorbing more nutrients at the same time.
Yeah, and you know, just like anything, in order for us to really pay attention and want to change our habits and, you know, try and reduce our inflammation, we need to be scared. So what are some common conditions or, you know, what are risks that inflammation can lead to, like other than just like bad gut health or
Go ahead,
Well,
like
at the basis, once we understand inflammation and understand the causes, stress is a risk factor. Lifestyle is a huge. We're learning today that the American Cardiac Association has determined that, and this is not something that does require common sense, but transcendental meditation is the only thing that actually lowers blood pressure. So meditation, finding a ability to help the patient understand that it lowers the blood pressure as a thing that you can do. Obviously, you can take medications. You can also change the food styles. So the stress levels that we have is a huge area. So that's the thing that we have come to understand that is a predisposing factor. You have genetic predisposition also. We have a new player in the whole world of hypertension. It's called metabolic syndrome. Metabolic syndrome is a cacophony of disorders such as high triglycerides, increased belly fat relative to the waist. Those are predisposing factors. You have high cholesterols, low HDLs. HDLs are considered the good fats, and we want to make sure we have those high. Those are the guys that pull the fat out of the artery and take it back to the liver for processing. The LDLs are the ones which you want low. Those are the guys that take the fat and put it into the arterial wall. So when we look at those things, those predisposing factors, we can assess that. We can monitor blood pressure. The issues go beyond, because the smart doctors in the room are always going to look towards the kidneys. The kidneys, when they're damaged as a result of high blood pressure or someone that has a kidney disorder, they're going to create implications or problems later on in the future. So it's very imperative that we get blood pressure under control at the earliest possible. The other things that we have to look at are even genetics, genetic predispositions, the types of medicines that we have, the crossed use of many medications have, as a result, a side effect of increased blood pressure. Our dietary predispositions, such as too much salts, too many of the wrong carbohydrates, too many of the wrong sugars, actually increase the blood pressure as well. The other thing that is also going to affect the heart is also diabetic issues. So insulin resistance is a huge disorder that over time, the body doesn't figure out what to do with the glucose, and it keeps on pumping out insulin. Insulin directly affects the arteries, directly affects the function of our organs, and leads to what we call visceral body fat. So the individuals that have a lot of visceral body fat, that's the fat that's wrapped around the organs such as the liver, the kidneys, and the gut. This stuff produces hormones, which directly affects what we call the aldosterone, the angiotensin system, the nitrous oxide system, which actually controls arterial compression. So we need to understand what is wrong with the individual through a very a quick assessment, even a metabolic assessment. We can figure out what we can do to help the individual get better and stronger, if that makes sense. I hope I've given you some ideas as to where to begin.
Yeah. So do any of those, like, what is directly affected if you have inflammation? Like, why would we be scared to have inflammation issues?
Well, again, as we look at it, inflammation is the first marker. Now, what we do as clinicians, we use a basic level of what we call C-reactive protein. C-reactive protein tells us the overall state of inflammation in the body. That gives us an understanding of what the overall sense of inflammatory changes are happening in the body. But it's a kind of like a, how is the sound in the gymnasium? You can kind of sense, okay, there's a lot of screaming people, so we kind of know that it's a ruckus in there. So it doesn't really tell us specific. Today, we can actually assess inflammatory markers, and it does make a difference. So what it does cause, it causes disorders. Now, let's just take one area. For example, if our intestinal biome is off, what we start learning is that we start having fractures in the intestinal wall and what we call a disorder called leaky gut. The bacteria that actually builds in those particular regions are going to produce lipoprotein lipase, which is a bad thing, from gram-negative bugs. That stuff causes an immune reaction that causes effect on the entire whole body in terms of autoimmunity is activated, could be activated in that sense. Also, we can activate even inflammatory results inside of the brain. So we can lead to issues such as central sensitization, which is a higher state of pain as a result. A lot of people, consider like fibromyalgia, for example. We end up affecting not only the mitochondria of the systems, but we also affect the neurological presentation as a result of a gut dysbiosis. So just taking one area, we are learning today about certain areas like dementia, Alzheimer's, Parkinson's. We are seeing that they all have inflammatory basis. Cardiac injury is as a result of inflammatory reactions that actually crack the arterial walls and cause a repair mechanism, which causes actually a reaction from what we call the complement system, which is the system that actually protects our platelets and actually activates our platelets, and we may have thrombosis as a result of it, or embolisms. So we do have a lot of things that cause inflammation, and it seems to span all the way. And we don't just have to have inflammation in terms of like a joint issue. It affects pretty much everything. So we now understand that we must keep inflammation at bay, if that helps.
Absolutely. And like Tony's asking here, is there a blood test for that C-reactor protein to see how much inflammation we have in our body?
Yes, one of the cool things that the Boston Heart Health has assessments can do, we can actually do advanced lipoprotein assessments, which take all the markers from all the way to heart damaging issues like troponin to C-reactive. We can also see the oxidative state of the body. So once we can look at someone, we look at ApoE, LPLL. There are different letters that indicate different types of fat markers. So we can actually assess those and really come up with a plan for the individual. Now, does it mean you're going to have an issue? No, it just means that the susceptibility, and statistically speaking, if you got a cholesterol of 300 and you got your HDLs at 20, you're not in the most optimal state. If you got a blood glucose level of 200, 300, we need to fix these issues, because ultimately we're going to have damage to the kidneys. So it's very important to also bring in exercise. Exercise is a huge component of this, because one of the things that we've learned is that exercise does better than even most cardiac medications. So you'll see the frustration many cardiologists, and this is maybe something outside my scope, but they say it commonly, and it's common knowledge that cardiac medication is a method to try to decrease blood pressure. However, exercise has an unbelievable ability to not only decrease inflammation, decrease oxidative states, and also be able to prevent even cardiac issues down the line in a way that most cardiac medications can't do. So we're in a world right now where exercise, understanding oxidative loads, oxidative states, also our biome in our intestine makes sense, and we start realizing that we have to have a relationship with our body. We have to understand that we have to relax. We're under an extreme amount of stress. Our adrenals are pumping out. The world's different, and creating a state of cortisol that creates inflammation in the body to the point where we are actually suffering from a great disorder called metabolic syndrome into these ages. So I hope, what I want to do is I want to make sure that the world understands that inflammation is one of the newest things that we have been able to tie through one system to the other, from the brain to the joints to the body to the biome of to the intestine, to the way the human functions. So we need to make sure we keep inflammation down. So to answer your question, there are tests to specifically assess inflammation. However, they have to be really, really monitored with the appropriate doctors in their particular field.
So it's not something they can go like to Quest when they're getting normal blood work and say, hey, sign me up for that blood test that shows how much inflammation I have. They wouldn't be able to do that.
Yeah, that's a good question, because actually you're going to have to do an advanced lipid panel, or you can actually do things through Genova or Quest. Different companies such as Vibrant, you can actually do the Boston Heart assessments. And what they're doing is that once the doctor orders those a little bit more elaborate tests, they can really, really break down and drill down into your inflammatory markers, along with your cardiac markers that actually make a difference. So it gives you a lot more tools than what we had 20 years ago.
Somebody's asking how often they should get the test done.
How often? Oh, if you have coronary, first of all, talk to a good cardiologist. That's what we need to see. Okay, we need to see that, first of all, you have to be in the right hands, and someone who does this all the time. My type of practice is a general practice, and I can identify the issues, and I use cardiologists. But to answer your question, how often? If you've got cardiac issues and cardiac markers, you're going to find doctors reassess you between 3 to 6 months, depending on the complications of the issue. If it's more, and you have more complicating issues, much sooner and much more often.
All right. So it sounds like exercise is our way of, how Daniel put it, is calling our body's plumber, right? And then just kind of.
Yeah, and exercise does help. One of the biggest things is Dr. Jimenez was talking about the meditative state is if you go in any exercise program, you go in, sometimes we go in to let off steam, right? But if that steam's not let off during the end of the workout and you're still in an irritated and annoyed state, your homeostasis balance won't change. There was a study done that two separate groups, and they were actually a study of actors, so they can get into that emotional state. The two actors, the ones that went in an angered state, and the other ones that went into a peaceful state, the ones who were in a peaceful state did very little. Their homeostasis balance levels changed and stayed even. Whereas the angered people, they pushed harder, worked harder, but their homeostasis levels stayed the same, blood work stayed the same, and they're still just as bad as before they started. Reason being is that just how important, in other words, you have to let it go. You have to let things go. And if you keep holding on to things, it's like a giant pressure cooker. If you don't let out the steam or the pressure, it's going to blow up. And it's as simple as in layman's terms. So things are as good as you allow them to be inside of you, because it's not a one-size-fits-all type of deal, and everybody's looking for that quick fix. So with exercise has to come with a good nutrition plan, good eating, a good way to cleanse out your system. You have to drink water and things like that. And you got to start with something that's going to allow you to succeed. Because if many times, well, I want a strict diet and I want this, and you're going to set them up for failure before they even start. So you got to set them up in a way that not to put them in a more stressful situation, but something that's going to allow them to live a functional and better lifestyle, so that they can still go to work, still have fun with their kids, but not to the point where like you work them out so hard and now exercise, they don't want to do anything when they get home, and before you know it, it's going doing the adverse effect than helping the body in itself.
Right. Some people don't realize how much stress how much it affects weight gain or negative weight gain. Like they might know it does, but not how badly it directly correlates to weight gain, just stress alone.
If I may, one of the things is in today's society, we deal with a lot of stress. From the moment we wake up with this new COVID dynamics, we've been under an enormous amount of load, whether financially, emotionally, many dynamics are changed. So we're humans, we're mammals. We were meant to meet each other. We're meant to talk to each other. We're meant to communicate. This separation creates a whole lot of stress. Now, where is stress related and where does stress affect us? Well, we've seen that the initial areas that it affects is our cortisol response. When we deal with cortisol response, we deal with issues that affect the blood sugar. Now, when a person's under constant trickle of stress, we're going to produce cortisol at certain levels. And you're going to be able to see that if someone's stressed out, they're usually bloated. Mm-hmm. They usually gain weight. So you don't have to ask them, are you worried? If you see your friend and they look like they're kind of swole, but in the bad way, their face is puffy, their bodies, they look more like an apple-shaped individual than when they were thin, they're under a lot of stress. Once the cortisol reaction starts occurring, it just starts putting the person into a constant state of fright and flight, so to speak. Excuse me. So what happens is that as that occurs, the insulin becomes less effective, so it doesn't absorb well. So then what happens is the body starts experiencing what we call insulin resistance. As that occurs, the insulin starts pumping out more and more in resulting to the cortisol response. As it does more, well, there are hormones that are activated that make the fats or the triglycerides inject inside of the in fat cell, and that is controlled by insulin. So if insulin is more prevalent because it's not as usable or as active, it's going to make the person gain weight. And over time, you're going to have a different body type in a person who has undergone chronic stress, if that makes sense.
So he was talking about, making sure you exercise and everything, and you were talking about the quarantine and how COVID has affected so much. So say, for example, people have, I need a gym to work out, otherwise I can't work out. So you don't have a gym. What's the best next solution, Doc?
In terms of the gym, in terms of finding a gym, is that what you're mentioning?
Well, I mean, yeah, a lot of people give you the excuse right now. Well, I don't want to go to gyms because I don't want to be around people. I don't want to be around this. I don't want to be around that. You know what I mean? So
right.
Then what's our response to
Well, our
those
response
people?
has always been, look, your body's built in a certain way. One of the things is that in my respect, I'm a 220-pound guy, right? And And Danny, how much you at?
So to 230 of solid muscle.
You're about 110 pounds. You're 110. So anyway, when we look at that,
it's about to get ugly, guys.
What happens is that once you you realize that you can't go to a gym, or you're having let's say a disability or an inability to go out, or you just fear. There's a lot of things you can do in terms of your body. You can create your own gym. The body was designed to be able to use dynamic movements. You do 15 burpees, you'll realize you can really, really, really increase the cardiac output real fast. So once you learn through videos, you can do videos. You can use dynamic movements that are taught by someone. You can do from yoga to exercise in the house. You can use your body with some simple tools, or just basically 2 cans of soup, whatever, and do that enough and bounce around in your house. Use rubber bands. Use these basic dynamic special equipment in terms of like just simple rubber bands. You don't have to need dynamic stuff or machines. You can do exercises around the house, do lunges around the house, do things that you can from push-ups. Remember, the gym is very new. I mean, relatively the way it is. Back in the 40s, there were just pulley system cables being used. Today, we're going back to those ways. So someone can find out things that they can do in their house and exercise in ways that are just very simple.
Right.
And lucky for city employees, you guys have options for virtual group fitness classes. Got to throw that plug in there.
I was about to say, where you at, Christina? So, okay, exercise, yes. I mean, I'm sure we drill it into their head every week. Now, as far as diet-wise, you guys mentioned diet. What are some things that we could eat, to avoid inflammation or to reduce inflammation?
Go ahead.
Well, I mean, let's go back and forth as far as like, you used to bodybuild 6 times a day, eat 7-8 times a day. That was a thing. We both tried, I do intermittent fasting. We both tried intermittent fasting. Intermittent fasting has some great studies and research done as far as lowering insulin sensitivity, blood pressure, and inflammation. It's great. Ever since I've done it before, I felt I've been less stressed, less bloated, less inflamed, things like that. I've found that it's worked great. What do you find that's worked great for your, considering that, you're a doctor, you're with patients all day long. It's hard for you to squeeze in meals. It's hard, it's really easy for yourself because there is a lot of overweight doctors, unfortunately, because they see so many patients. What's your go-to, obviously, than just working out, because we know you work out like an animal. We can tell with your big old biceps there.
Yeah, I got to feed the guns. The guns have to be fed. The reality is that these guns cost a lot of money when it comes to protein. No, so all kidding aside, we've learned a lot about dieting. As you mentioned there, intermittent fasting or time-restrictive eating. Once you understand that for many people, dietary changes can be adapted, what we can do is use different methods. Some are you needed someone to kind of look at your body type and see what's going on. There are body types, because you can't say everyone needs a Mediterranean diet
that's right,
or a intermittent fasting or time restrictive diet. There are different types of diets based on your abilities. What we do need is to talk to someone who understands that and assess your body composition by taking anthropometric measurements. Now, what we do here is we use body composition assessment so we can kind of monitor, because for one individual it may work, but for another it doesn't. So we have to adapt.
Exactly.
So we have to kind of work with the individual based on how much protein, how much fats, how much carbohydrates. But there are certain truths, right? A calorie restriction is typically a good thing. However, we have to figure out how do we going to control or compose the food of to make it work. So Mediterranean foods, Mediterranean style eating is high on greens, nuts, vegetables, a high fiber diet. But
which going back real quick to you're talking about metabolic syndrome. A lot of people who do caloric deficit for too long period of time will actually go into a metabolic type of syndrome, because they're limiting their body so much. So your body doesn't know when its next nutrients is going to come. So it's holding on to every little bit you got. So a lot of people don't have a misconception that, I'll just eat once a day and very little. If you're doing a restricted diet, you have to follow restricted eating, adhere to those guidelines. You can't just say, I'm just going to eat once a day. There's a process. There's a way to load your body to actually use those calories. Otherwise, you're going to slow your metabolism more and more. So if you eat too much, it's bad for you. If you eat too little, it's bad for you. But a lot of people would just think, well, I'm just going to go on a calorie deficit. That's why Dr. Jimenez was talking about the body composition, is you have to know how many calories your body needs on a daily basis to function. And then from there, you can adhere to proper guidelines that will work for you, because keto may not work for you. Paleo may not work for you. Mediterranean may or may not work for you. Intermittent fasting may work for me, and it may not have the same effect on Dr. Jimenez. Bodies differ, and so it's good to know where your body is at to ensure you get the best nutrients.
Healthcare companies have put a lot of effort in nutritionists now into preventative issues. So a lot of times you have plans where you can actually get healthcare where it includes having a dietitian or a nutritionist actually sit and kind of help you change those things. However, what is a nutritionist what are they going to look at? They're going to look at your body composition. They're going to look at your total caloric deficits. They're going to assess you. So it's not so easy as just kind of getting on a scale and saying, I look better, my pants feel better. Because my pants may feel better, but in Danny's situation, he may be suffering from a disorder that is low muscle, like sarcopenia, very oftenly that he has. No, sarcopenia is low muscle. It looks like it's muscular, but it's not. You got to be, but you. So in essence, what we have to do is we have to see the quality of the muscle, the amount of muscle, and how much water retention is. So it's not an easy kind of answer, because it requires a professional to be able to evaluate you on a consistent basis, if that makes sense.
And I'm glad you keep mentioning that, because I know we all want that straight across the board answer. What do I got to do, right? I mean, like you guys said, it's different for every single person.
Right.
You should go get an assessment, a personal assessment, and then go from there. Not just ask what I got to do, because I mean, Daniel's workout plan, I'm sure he's not going to give to someone that's never worked out before. If someone asks, well, what do you do? So I can do that. And that's why we do have, luckily, a wellness coordinator, Miss Christina, who looks like she froze. But that'd be a great start. I mean, you guys contact her. She does an assessment on you, and then you go from there versus just trying to get a generic, broad answer.
It's very important that you have a team. It has a team, that you have someone to talk to that can allocate the right resources for you. Because in today's world, you know what? We need help. We need assistance. We are individuals that some of us have real strong personalities, and a ketogenic diet is appropriate because we have the certain skill sets. But that's a very difficult diet to do if you don't have the gumption, or you don't understanding the implications of going through the symptoms of a ketogenic diet. So each type of diet is different. So so you have to go to a coordinator or someone that can help you through the process and through your development of your diet, because as we've indicated, we're all different. One bad thing that everyone should never do is probably too many Takis, like my daughter.
Yeah, exactly. Those kill your syndrome.
Takis are the food of the gods, according to my daughter, but I don't know.
It's crazy right now with so many kids at home. That's their go-to, especially because they can. You can't just up and get it. When you're in a classroom, you can't just go to a pantry and go get Takis, Cheetos, or anything like that, because, I mean, they're not going to have that at school. You have to be in class. But now, more so, for example, parents that, on Saturdays, Sundays, if you have a day off and you're just at home, what do you do? You eat out of boredom. You're not even hungry. You're just bored. So that's all these kids. The snacks are there. That's what they're doing. We're causing all of these overweight issues in and around people understanding, not understanding, well, I'm going to get a snack because I'm hungry. Well, in all reality, you're not hungry. You might be thirsty. A lot of people will confuse hunger for thirst. So if you drink a nice big 16 ounces of water, chug it, your hunger will probably go away. But people are like, who's going to opt out to go drink water? But that's where those small little changes start. People want these drastic, huge changes, but you have to start with small little steps. If you can master those, then inflammation, weight loss will come right after.
Mm-hmm. Plus, if you're drinking water before you eat, you might keep yourself from eating so much,
right,
more than you normally would. No, that's good. And then most insurances cover preventative services at 100% anyways, and that's for a reason. that's, a lot of people don't go to the doctor because, they have to pay, it's expensive. But a lot of the time, preventative services, like your annual checkup, is covered by your insurance 100%. So, and that's for a reason. I mean, we're supposed to go get ourselves checked out the same way you go get your car, checked out and checks and services and everything. I mean, that's the same thing, but for your body.
Individuals that are conscientious about taking care of their body and monitor their plumbing system or their chemicals, so to speak, their magnesium, their minerals, their labs, those people live longer. Those people actually know what's going on. You don't have to wait till you have a blood sugar that is high or a cholesterol level. If you monitor, as in most carriers which do like once a year, a program where they assess you, that's a great ability to be able to identify problems way before they happen and allow you to get control of it. You don't. It is easier to deal with something before it happens in the world of wellness than to deal with someone who's got diabetes or a heart problem already. So either way, we can still fix it, but it's better to have it beforehand. So these programs are designed to save lives in the long term.
That's a great point.
Which in El Paso, I don't know about any other place, but especially here, all of us are after the fact mentality. Like, we don't start taking it serious until something serious happens.
Well, that's a good point. That's a good point. At one point in the 90s, we were considered the fattest, sweatiest town in the country. Things are changed. Now, why has it changed? When I came here, there were very few gyms. The fitness ideology was a lot less in early 1990. But today, the world is different. People are understanding diets. We have a lot of really greatly talented individuals in nutrition that we didn't have as in the early 90s. So we're learning, we're becoming better, and we're becoming better. Today, we're the 33rd heaviest city in the country. Now, that means a lot because we're the 17th largest city in the country. So we're moving in the right direction. We have a lot of people changing the way they eat. It starts in the home. It starts in the early development. If I walk around and I see mom and she looks like she's not really paying attention to what she feeds, the children are paying attention. So we need to make sure that we as parents do the right thing, eat the right foods, so that our children can really understand, because they do more of what we do other than what we say. Stop eating Takis, and there's dad with the wrong kind of candy bar and smoking at the same time. It doesn't work that way. They do what we do and what we say. If that makes sense.
Exactly. You're right. I'm over here trying to get little Roman off the phone at night, and then the first thing he does when he sees me, hey, no phones at night, Dad. And I'm like, oh, okay, you got me. They're watching everything we do.
Yeah, that stops stress.
Yeah, exactly. It's if the parents, they're working out, they're moving, then it's a trickling effect. Eventually, the kids will do the same thing. It's the limitations and the things we allow in our household that will start creating good habits. But it does have to start with us at the end of the day. You can't push your kid in. Well, I want to do this, I want to do that, and you're pushing 300 pounds. I mean, that's a little hypocritical. It's got to come from both ends, and I think that's the way we evolve, and we teach our kids to be youthful, young, and create good habits. Like I said, I think people take it out of context sometimes. Well, I don't want to have a six-pack. It's not about having a six-pack. It's not having about the biggest legs, biggest chest, or anything like that. It's just about being healthy and living longer, so you can enjoy the life that you've worked so hard at building.
I noticed one of the questions there, Saz, is it possible to get off statins? Well, first of all, before you get off a statin, you want to make sure you talk to your doctors. However, we are finding out that many nutritional ways can actually help. And like red yeast rice, those have been known to be as effective as a certain amount of statins. Now, they're not the heavy loaded statins. Statins have their benefit, but we all know that somehow, some way, we're going to have a mitochondrial issue. As long as they're starting to take coenzyme Q with these, it's very important. So a lot of people want to know, can we get off medications? I leave that for their doctors. It's very important to say that. But there are ways to adapt dietary changes so that you live a healthier life. There are ways to lower your blood pressure by up to 60 points by just nutritional adaptations. So those things are very important, and we could discuss those things at a real complex, because as you go into them, from simple thing of drinking water from the morning to lower your blood pressure, to the way how much fiber you take, you can basically work as well as taking a statin.
All right, doctor, you got another question there.
What's that one?
Is there any way to access the health of our mitochondria?
Yes, absolutely. The mitochondria is a dynamic organelle in the body. First of all, exercise is one of the greatest ways to make the efficiency of the mitochondria better. So we got to drive that. That engine's always sitting there. Mitochondria, we learn about mRNA. It's almost like you give your body a bad run or a good run, so to speak. Your body takes note. Your mitochondria will adapt. It does it through the mRNA system. It's a real complex system, but you can make it more efficient by exercise. It's one of the big things. As to giving it its true health.
I'm glad you guys are bringing on the questions.
Yeah.
One thing, since we are preaching to be proactive, are there any basic signs, if any, that we can look at or see or notice as far as inflammation in our own bodies?
Yeah, swelling.
The scale.
Yeah, the scale.
Like red flags or anything
swelling.
like, you know what, I'm seeing something like that. Maybe I should go get checked out.
Yes, you can do things. Is take a look at this swelling. We got to make sure that our body doesn't swell. What was the question again? Because we were in the middle of trying to figure out the sound.
On ways on
Just
detecting.
basic signs or red flags that we might see in ourselves.
Oh.
That kind of show us, what, inflammation is going on, and we need to go get checked.
Headaches, fatigue.
Yeah, pain, joint pain. It's one of the things that bring people into like stomach discomfort. Anytime you have inflammation, your body has a keen way of telling you something's wrong. And if it can't, typically a symptom will present itself. What type of symptoms? From headaches to nausea to you look at your legs and all of a sudden you notice that they're swollen. There's clinical findings in the body that demonstrates swelling, from redness to even skin changes. So you can see that someone who's got prolonged swelling in a certain area, their skin just changes.
Also, I'm sorry.
Go ahead.
Also, bloating, constipation, not being able to go to the restroom on a daily basis correctly, or forcing things like that might be a sign of inflammation in the gut. Even urinating correctly. If you're urinating dark yellow, that can be a sign of some sort of inflammation. Not I'm just being general here, just so people can get the most basic things to look out for.
Yeah, once your body starts becoming concentrated, one of the things that we recommend in all pretty much doctors, except certain kidney dysfunctions, is increase their water intake. So that helps you alleviate and make the things work better. When you make the body pump, it starts working itself out. If you've got obviously kidney issues, well, we want to monitor the amount of water you do have. But however, in most situations outside of that, water becomes a very important component to decrease inflammation. So the more diluted, if your urine looks like it's red, we need to talk about issues. So we need to sit down and evaluate that. Urine tests, blood tests can evaluate that, see kidney function to determine what's going on. But we need to make sure that we get inflammation under control.
And then the last, I know they're saying it's, there's something to be said about our pill culture. It's not just a matter of what I can take, but asking your provider what you would advise. Yeah, I believe that's completely correct. We are a society of pill poppers. Unfortunately, we're on a quick fix for every single thing, and we have to ensure that we know the proper steps of what we're dealing with, how we're feeling, and taking the necessary steps to prevent and or make ourselves feel better. One of the biggest things is during summer is and I'm in no way I'm minimizing COVID in any way, but if people felt like they had a headache right away as symptoms of COVID, one of the biggest things is you might be dehydrated if you have a headache. You might have not had your caffeine. Maybe you have too much caffeine. Your body has triggered certain hormones in your pituitary gland that release a certain feel-good type of feeling to make sure that you have you feel good. And so when you take that caffeine away, you have those headaches. So in other words, there's certain things that you have to assess yourself on a daily basis to ensure your body is corresponding to the way you're feeling. You only had 4 hours of sleep. Next day, oh man, I feel sick. I feel this. I'm et cetera, et cetera, et cetera. Well, no, you had 4 hours of sleep. So you're really exhausted. You're tired. You need to go get some rest and stop drinking so much caffeine. Or you're dehydrated. Go drink some water. Once you drink some water, then assess from there. But everybody wants to jump from A to Z right away without going B, C, D, E, F, G, and seeing all those necessary steps beforehand, right, Doc?
Absolutely. I mean, we got to realize that sleep, you can take all the pills you want. You can take all the drugs you want to try to deal with lack of sleep, but you can't pill away sleep. Sleep is a way that the body restores its normal balances. So we must have sleep. So you've got to make it an integral part of your process. We're learning today that those individuals that even when they leave the hospital, they give them melatonin. Why? Because they want them to start the process of sleeping properly. Also, melatonin has some physiological effects on the transmissions of this new disorder called COVID. So that is one of the big things that we've learned. So sleep is critical at the recovery process. It's also one of the most important parts in stopping inflammation. So we need to now be a culture of understanding and respecting sleep. So you're in terms of your child, as you mentioned, hey, the dad, the phone, it's important to be able to walk away and to close your day off and end your day appropriately so that you can rest, to go to bed early, to be able to drink your water, to make sure you take the right amount of fiber. These things help you. So as it's a multifaceted approach when you look at trying to help inflammation, healing, and the recovery processes. So yes, we definitely, sleep is huge.
Right.
And it's funny that pills is brought up because I don't know about the rest of everyone here, but when I hear inflammation, I'm thinking ibuprofen. Because some people I talk to, they're popping 800 milligram ibuprofens like nothing, and I'm like, well,
I'll tell you
probably
what.
Not even prescribed to you to begin with.
You got someone here who has lived a bit. I'm closer to 60 now, and I've been here since my 20s. Nephrology it's exploded, and the reason why nephrology has exploded is nonsteroidal anti-inflammatories, such as the ones you said. We've seen naproxen, so we've seen ibuprofen. We've seen the effects that prolonged use of these joint mitigating medications have affected the kidney function. Literally, we need to understand that if we take those medications for any long period of time, we are going to destroy your nephrons. It may seem the appropriate thing, but before you know it, you have high blood pressure and you start realizing that, oh my gosh, you go to your doctor and he tells you that after taking ibuprofen for the last 4 years and 2 pills every day, or the next one, let's say Aleve or Tylenol, we take the effect that we can't be taking those for a long period of time. If we do, we're going to have secondary issues and secondary organ damage. If we do that, we sometimes don't even know, because kidneys have 5 stages of disorder. By the time you're at the 3rd or 4th is when you start having symptoms, but slowly you start destroying your body. So we have seen a huge increase in nephrology centers as a result of nonsteroidal anti-inflammatories, just to take that knee pain away that people are having. However, what can we do on the opposite? There's a lot of natural options. Coenzyme Q, you have curcumin, that's one of the big ones. Turmeric, which is, a lot of people know that. You take your omegas, which are anti-inflammatory. Our grandparents knew this. They would give you cod liver oil. What's cod liver oil? It's omega-3s. So we start taking that. We increase your fiber through flax seeds. We take 2 tablespoons of flaxseed. We have flaxseed, muffins, so to speak. And you realize that all of a sudden now your triglycerides or your lipid panel starts showing better. So, and also inflammation goes down. And all of a sudden you start realizing, I feel great. My joints feel good. And it's very important. People forget that water is very important in the mitigation of joint pain. So drink water. You got to drink water. Some people don't like water. They say it's horrible, and they'd rather drink something else instead of water, when water is the thing that assists our body. Does that make sense?
Mm-hmm.
I think that's great information. And also know the things that can cause inflammation in our regular diet. Like some people think, oh, I'll just add some turmeric or ginger into my diet and everything will be great. But what else are you eating? So is there any way you can quickly just talk about things that maybe can lead to inflammation from
Absolutely.
regular
Absolutely.
everyday foods?
You got the meats, too much meat, inflammation, okay? Sugar. No, you got to get rid of that. If you want an option, if you got a sugar tooth, do maca sugar. It's a good type of sugar that is natural. You got to avoid inflammatory foods. Now, the inflammatory foods depend on in the individual, because there are certain food sensitivities that we find that are causing inflammation and an immune reaction based on an individual. For example, I may have a reaction with peanuts, and Danny over here may have issues with a molecular component of corn. We have to do food sensitivities if the person has chronic inflammation to figure out what is it that is causing this inflammation. With today's technology, it may seem kind of evasive not to give you an answer, but for sure, sugar, okay? Alcohol causes swelling.
Fried food.
There you go. So, go ahead.
You know, the basics of those.
All the good stuff.
Yeah.
Everything everybody's going to eat on Sunday, right?
And so, no. Well, see, here's the thing. I think people think, well, I got to live, perfect Monday through Sunday. That's not the thing. You know the saying, an apple a day keeps the doctor away? Well, you can't eat just apples and be healthy. You're going to miss a lot of key components and nutrients. So too much of anything is bad. And the thing is, people don't balance. They think, oh, well, I messed up today, so I'm going to mess up the rest of the week. No, mess up today, you get back on track, and you keep continuing with the right things. You know, my cousin was pre-diabetic, and he said, well, what do I do? Well, what do you do now? Well, I almost eat out every single day. Okay, don't eat out every single day. Eat out twice a week and see how it works from there. In a week, his blood sugar levels went back to normal. That's how much people don't understand that they go out and get things that are not good for them, because you think fast food restaurants, all these places, oh, well, let me make sure not to push too much salt or too much sugar of this or too much. No, they want to make it taste good so you can come back and buy it. And that's the thing. You can enjoy life, but people think that they can enjoy life every single day without consequences. If you spend every single dollar that you make every day in your bank, do you think you're gonna have anything at the end of the week? No, you're gonna have a negative. So think of your body as a bank. If you overspend, you're gonna have that negativity and negative reactions within your body, and you're gonna find out that you're gonna be broke, so to speak.
Yeah, there are things you can do to mitigate. You'll hear the conversation of the omegas. For example, when you eat fast food, well, fat foods have good oils too, but they're like too much of omega-6s, right? So when you were talking about balance, it's the excessive omega-6 imbalance relative to the omega-3s. So, you know what, you can take some omega-3s if you're going to have a day or a moment when you're going to have a bad meal in there, right? So to stop and counter the excessive imbalance, because the imbalance is what causes inflammation. So we can take a look at those kind of dynamics.
Mm-hmm.
Well, this has been very informative. I think it was hard to really consolidate in an hour, and we'll definitely try and dissect some future sessions with you all on maybe just, talking about one thing in particular so that we can really, understand it. But I thought this was great. There were some great questions coming in. Thank you so much for being our special guest.
Well, I appreciate it. Thank you so much. And I don't want you to feel bad, because inflammation is the center of many dynamics. You can't really put it into an hour conversation. It's a huge.